All right, well, we'll get started because we've got such fantastic attendance right on the hour, and I'd like to just let people know that we're recording this session. So if you don't want to be part of the recording, please just turn your video off and don't comment during the session. And if you want to, you can also change your participant name as well. But we really do encourage you, if you feel comfortable, to keep your video on and comment throughout the session. So on behalf of the International Alliance of Academies of Childhood Disability, it's an absolute pleasure to welcome you here today for another one of our listening and sharing sessions as part of our world tour of these listening sessions apart yet together. And it's fantastic to have such great attendance from the Irish crew. So I'll hand over now to Margaret. Thank you.
Thanks, Alicia. Good morning, everybody. And again, on behalf of the Irish Academy of Childhood Disability and the International Alliance of Academies of Childhood Disability COVID-19 Task Force, you're all very welcome to this morning's listening and sharing session. For those of you who don't know me, my name is Margaret McGrath. I'm an occupational therapist and I work in Children's Disability Services at Enable Ireland in Dublin. I'm also the Irish coordinator of the European Academy of Childhood Disability, and I co-chair a group of people who are in the process of setting up the Irish Academy of Childhood Disability. Unfortunately, we've been sent slightly off course as a result of the pandemic, but we're not deterred, and we hope that this goal will be achieved in the coming months so that we have a professional organisation which supports interprofessional practice development and a collective voice to drive forward high standards of services for children with disabilities. It was amazing to see all the numbers of registrations given the short notice of the session. We've had 40 registrations and we have people joining us this morning from Ireland, Nepal, Israel, Spain and Italy, so you're all very welcome. As Alicia was saying, this is a special session as it's part of a 24-hour global event marking World Cerebral Palsy Day. So we're really delighted to be participating in Ireland. The purpose of the webinar is to share our experiences of working and living during the pandemic, sharing our achievements, the solutions we may have used, the challenges we have faced, and from all of that, what we could take into the future for service delivery. All around the world, people and communities have had to adapt to big changes caused by COVID-19. And I suppose people with disabilities have mastered dealing with change, breaking down barriers and coming up with creative solutions their whole lives. So I know in my own experience, working with children with disabilities and their families has, always been inspiring, but particularly during this time when, they're actually the people who know what this feels like because they've lived it for so long. I would like to welcome Dr. Alicia Spittle to our session. Alicia is the co-chair of the Australian Academy of Childhood Disability and Developmental Medicine. And as she's hosted so many sessions already in the last few hours, and this is our first time giving it a go in Ireland, she has kindly joined us to help us out. So thank you very much. I'd like to welcome our panel of speakers who have given us their time, and I thank them all so eagerly for agreeing to take part. We have Dr. Mairead Dempsey, who is an occupational therapist, and Mairead has been the Irish rep on the COVID task force of the International Alliance of Academies of Childhood Disability. She will give us a background to the work of the task force and its ongoing plans. Dr. Irwin Gill is a consultant paediatrician working in disability and rehabilitation in CHI at Temple Street. So he works in acute rehabilitation, neurodisability and the spina bifida services, and Irwin will discuss the impact of the pandemic on the acute hospital services. Sinead Henry is a parent and she will share her experiences of her daughter's care from both the acute and community-based services. Margaret D is an occupational therapist and will share her experiences of delivering remote group therapies. And Sinead Bird is a physiotherapist and will discuss her experiences of the impact of the pandemic on the delivery of services within her organisation. This is a listening and sharing session, so I suppose we want to hear from all of you as well. There should be a chat box where you can comment as we go, and when the speakers are finished, we would invite you also to contribute, to comment and to share. Thanks again for joining us this morning, and I'll pass you on to Mairead.
Good morning, everybody. It's lovely to see everybody. So my role, I suppose, in this is in the early stages of the COVID lockdown here in Ireland. I was approached by our newly formed committee and asked if I would take on the role of representing the Irish Academy on the international task force. So I joined the task force at that stage in probably early April. And we, at our initial meetings, we chose 3 areas to focus on. And these areas were the surveys, resources, and the listening and sharing. So the survey group, they're looking to find out what the short, medium, and long-term global impact of COVID-19 is having on the physical and mental health and the participation, education, service provision, and financial status of families and children with disabilities around the world. So to date, they have found 32 surveys that are taking place around the world, and 15 of these have been completed, and there are 17 surveys still actively happening. And I suppose they're encouraging everybody, if you're doing any sort of research or surveys, to contact them and make sure that your research is in the mix and that they will help to disseminate it. So the research group that I'm working on, we decided we'd try and gather and collate the information and the resources that are being developed around the world by everybody in trying to cope with this crisis, I suppose. That includes information. We have 3 sort of categories: information to support clinicians in delivering services and families in coping with what's happening during the pandemic. We also looking for ideas about strategies that have been successful, and information on how to reopen services, which obviously is a big deal for all of us as we learn to live with this virus. And then the last group is the listening and sharing session, which Alicia is on. And these sessions were set up as a way to connect and promote open communication across groups of people, and to share the experiences that people are having in dealing with the pandemic. So they've also put together a really good tip sheet on how to organise and conduct these sort of sessions for both professionals and consumers. And obviously this is a biggie, that we're doing 24-hour sessions right across the world today. So anybody who's interested in participating, sending us resources, setting up listening and sharing sessions, you will find all of the information you need on the IIACD website, and the link to that is on the slide that's on at the opening and the closing. So we move on.
Thanks, Mairead. I will share, I think Erwin's next, so I will share your slides.
That's great. Thanks very much, Alicia. So as she said, Dr. Erwin Gill, I'm a consultant paediatrician working in rehabilitation and disability in Temple Street. And this is presented humbly in, I suppose, description of some of our experiences, but by no means presenting it as a list of all the answers. Next slide, please, Alicia. Given that this is a international presentation, just for a little bit of context, that's the outside of Temple Street. So it's the second largest children's hospital in the state. It's one of 3 tertiary teaching hospitals in Dublin, which are all being amalgamated together over the next couple of years. But as you can see, it's in a very, very old building. Dickensian is frequently used as a description of it, which has presented some particular challenges, I think, specific to us in terms of dealing with COVID. In terms of the disability stuff, I'm the lead for the acute rehabilitation service from a medical perspective. Temple Street is the tertiary referral centre for neurosurgery in Ireland, so there's a lot of acquired brain injury. We have a large and growing neurodisability team within Temple Street, so there's 5 consultants. We now thankfully have a clinical nurse specialist and a social worker and a few others on the way, working within developmental delay, complex neurodisability and complex care. And we're also the home of the National Spina Bifida Service, which I have the privilege of co-leading. So there's been plenty going on, and we've found that COVID has had differing impacts on different services, which I'll go through now. Next slide, please, Alicia. And I think my first experience, I suppose, really in the early phases of this in March and April, as it unfolded, was I suppose honestly a feeling of helplessness, that we were kept away from our patients, who were obviously, all of our clinics were initially closed down before being slowly reopened. And we all had a feeling of wanting to do something to help, but really struggling to figure out what that was and how we could be of assistance in the early phases. And I was struck listening to some of the other listening sessions that have happened. My old boss from Westmeath in Sydney, Mary Claire Waugh, speaking similarly, that one of the things that she found on reflection to have been valuable was simply letting families know that you were there for them and that you were thinking about them, and that whilst things were different, that we were there to be contacted. And I think, much like Mary Claire reflected, and I would recommend listening to her recorded comments if you have the chance. We perhaps could have been faster to do that, but we did get there eventually. To go back to the start of how all of this felt at the time, I was struck remembering at the time that there was a doubt amongst the disability community in Ireland as to whether or not they would have equal access to ICU care. Which was a sort of a frightening place to begin. And we were getting a lot of calls from families who had clinical worries about their children, but were afraid to bring them to hospital out of fear that they wouldn't be given ICU care. And we were part of some advocacy work within the HSC to try and, I suppose, update and make more appropriate the guidance for rationing of ICU care. Thankfully, we never got to the point of needing to do that, but the guidelines, thankfully, were updated. We can move on to the next slide, please, Alicia. And that was with the support of the HSE. Thankfully, they updated the guidelines to make it clear that no one was going to be discriminated against. And on to the next one again, please, Alicia. We also were able to I suppose, release a specific statement from CHI with input from the intensive care departments, reassuring all of our families across all the sites, so that's here and in Crumlin and in Tala, all the Children's Health Ireland sites, that nothing had changed, that children would be treated as they always had been. The cases would be triaged as a case-by-case basis, and nobody with a disability needed to be fearful of coming to hospital for fear of having unequal treatment. So I suppose that was quite a scary few weeks for families, and I suppose we're in a fortunate position to be able to ultimately reassure them and put that statement out. We can move on to the next slide, please. To move on to the practical bits of what happened after that, and one of the big impacts that we had with Temple Street is that space is a real premium. We do not have a big modern building. We might in 3 or 4 or 5 years when the new hospital arrives, but we don't have that yet. And there simply wasn't enough space to allow for physical distancing. And what that ultimately meant is that we had to operate rotating systems whereby staff were on site or off site on a scheduled basis, because there simply wasn't enough room for everyone to be there at the same time. And we were worried that due to shared office spaces and cramped areas, that if one person contracted COVID, that we could wipe out entire teams and that the whole services would be gone. And what we ended up doing was running services where one person was in charge for a given cohort of patients for all of the consultants within our team at one point, which was extremely challenging and was compromising in terms of continuity of long admissions. But our HSCPs likewise couldn't all be on site at the same time, which very much reduced consistency. They would say this themselves, and it's no criticism of them. It very much reduced consistency and made it difficult for them to offer the same services that they would have offered before. Next slide, please. In terms of outpatients, initially speaking, all of our clinics were cancelled, and I suppose this is some of the areas where we've introduced things that have subsequently proven to be helpful, and some of which we will keep. So we decided that new patients were not suitable for virtual review. So for a couple of months, we had no new patients coming in, and our wait lists were extended as a result. But we did introduce virtual clinics for review patients, and now our clinics, which are now back at full capacity for the last 3 months, we continue now to operate a mixed policy of face-to-face patients and virtual reviews as well, which is something that we will keep going forward, as in retrospect, not all of our appointments that we had previously needed to be done in person. Ones for disseminating results come to mind. But I suppose I'm conscious that I have there's a lot of colleagues from the community online today, that the impact of closed community teams has been absolutely profound on our service. And that again is offered not in criticism, but just in recognition of the shared workload and responsibility that we have for this patient group. I suppose typically speaking in the neurodevelopmental clinic, our diagnostic assessments are often highly based on the feedback that we get from our HSCP colleagues, and not having them around has certainly slowed things down, and had an impact on patients. Next slide, please. And then in terms of the acute rehabilitation piece, which is, I suppose, the specific piece for Temple Street, the extra fly in the ointment that we had at the start of this is that Beaumont Hospital, which previously looked after all children with head injuries over the age of 6, closed its doors to children to make space for adults, which meant that all of those children, it's about 200 to 300 a year, were transferred to Temple Street to be accommodated without any additional resources, no beds, no HSCPs. Some of you may have noticed we're now recruiting for HSCPs, but for months we've had no extra resources and a significant increase in workload. We were building an acute rehabilitation service. We had an exciting goal-setting initiative which temporarily ground to a halt, and several other QI initiatives were delayed as well. But the other impact that we've had, again, to come back to the community team piece, is that planning for discharge when you don't have teams open and ready for business in the community was made extremely challenging. And I suppose the value of those community teams, I don't think we needed reminding, but it was made abundantly clear just how hard it is to do that discharge planning piece if you don't have colleagues available. And I suppose as those services have come back online, we've really seen the benefit of that, and we're very grateful to have that support back again. So that's been our experience. That's where we've been to date. As I said, offered humbly, not in suggestion that we have all of the answers, but that's where we've been. And I'm certainly happy to hear people's comments on that as we move on through the day. Thank you.
Thanks, Erwin. Sinead, we'll move on to you now.
Yep. Okay. Good morning, everyone. I hope you can all hear me okay. As Margaret said, I'm a parent and my daughter is currently using the early intervention services. Just to give you a bit of background on my story, Grace came 13 weeks early, so she came very premature. She came at 26 weeks and 6 days. Never in my life did I think I would have a premature baby. You kind of think you're going to go full term, and it just didn't happen for us. So we were very quickly put into the neonatal NICU lifestyle. And unfortunately, on day 2 of life, Grace suffered a grade 4 bleed on the brain on her left side and a grade 1 on her right side. The grade 1 seemed to resolve itself, but the grade 4 is really where we started to have issues. The neonatal unit did weekly scans, and unfortunately, it had shown that the damage had already been done. And at that point, they had decided that they wouldn't do any additional scans for Grace, but we would be referred to the early intervention team on discharge. In addition to that, Grace was also discharged with an open PDA in her heart. So we had multiple issues going on with her on discharge. Come early December, we met with the early intervention team in Enable Ireland, who I think up until this point, whilst I'd known about Enable Ireland, I never really fully understood the services that they did, what they offered. You kind of think with your firstborn, you're not going to need a service like this, but I can honestly say from the first referral, we were truly blessed to get in with that service straight away. We've never felt more supported. Having your first baby is tough, but having a first baby that requires additional resources is extremely tough. We met with the team and we worked on a plan for Grace, and honestly, we felt so supported. It was great. We met with the team in early March to have an assessment, and 2 days later, we were put into lockdown. And I think when we were initially put into lockdown, my first thought was never for myself or my husband, how the pandemic was going to affect us. It was definitely for Grace. I kind of felt that, are we going to be abandoned at this point? The country wasn't prepared for a pandemic. There was no plan B for anyone or any organization because nobody, saw this coming. And as much as you try and think that the company is working out their plan B, for us, we were frightened of being left isolated. Was it going to be a massive detriment to Grace? We'd gotten so far with her work in terms of her mobility and working on her key skills that we kind of thought 6 weeks into a lockdown, how is this going to help her? And we just panicked. We absolutely panicked, and that's the only way I can describe it, is that it was almost like a feeling of just being lost. We really didn't know what to do. And thankfully, Margaret, who is our occupational therapist, worked so hard to put a plan in place as to how we were going to keep going. And I think it was in and around 2 or 3 weeks into the lockdown, we noticed that Grace had stopped moving her right side as much as her left side, and panic stations kicked in again. And you want your best, for your child, you really do. And you just, as a parent, sometimes it's difficult to put that practical hat on, and you need someone there to assess your child, and you need someone to look and see how are they going. But thankfully, the services at Enable Ireland were able to arrange video calls for us, which it got us through the pandemic. It really did, because they were on call. Margaret and our physio and our social worker, they were available through email, through video call, and it just meant that Grace was still getting the treatment that she needed, albeit not face to face, but it still meant that they could keep an eye on how she was progressing, and they could give us exercises for her to do. And we started to kind of not feel as lost anymore, because she was so tiny when she was born. You're wondering, are you pushing her too hard, especially with the open hole in her heart. Come July, then we finally got a date for Grace's surgery, and she had the PDA in her heart closed. And what COVID really meant for us was, my husband was very much pushed out of any of her care in terms of hospital follow-up appointments with consultants, because it was a one-parent policy. So whilst you're sitting there trying to understand what you're being told, it's very difficult to take all the information in by yourself. I've always had my husband as a person who, where I might have heard something, he would take away something different, and we could kind of come home and compare and work out what we were being told. But when we went initially for a 6-month wait to the week later for her PDA, and the doctor was just throwing so much information at me, and I was like, well, hang on, and I'm asking him to repeat himself, and in a way I felt like a bit of a burden, or a bit stupid, because I constantly felt like I was asking him to repeat himself, and it was purely because of the amount of information he was throwing at me, whereas I didn't have that second person. And when you try and bring all that information home to relay it, then you've missed bits, or you kind of think of different bits throughout the day. And again, that kind of left my husband feeling isolated in a way that he wasn't actively participating in Grace's care as I was. And it put an enormous amount of pressure on me, because I became the key parent in terms of doing the hospital appointments, doing the video calls, and all of that. And that's really tough, particularly like it was our first baby as well. So, you have that whole new issue of a newborn. But again, like I said, you have the issue of the newborn with additional requirements. So thankfully, when we kind of came through the worst of the pandemic, and Enable Ireland was able to open up some of their clinics to help us, again, that kind of brought us back in touch with people. And as much as you have the video calls and you have the emails, sometimes you can't explain yourself, or you can't really see how a child is progressing. And whilst I can say in my email, Grace is doing X, Y, and Z, it mightn't be the correct way that she's doing it, or I'm interpreting differently, or I'm not really, looking for what I should be. And that was always a concern of ours. So once we kind of got back into the clinic, then they did a reassessment with her, and the difference in her from her March assessment to her August assessment was phenomenal. Like, even for me to notice it, like, I see her day to day, but I could see a huge improvement based on the time difference. And that is honestly down to the support that we had from Enable Ireland during a pandemic. Had they not have been able to put the video calls in place, had they not have been available by email, I can honestly say, hand on heart, it would have been a massive detriment to Grace and to every other child experiencing the service. I can only speak on Grace's behalf, but the service they provide is phenomenal. And I kind of felt like they were slightly let down by the government, because we were just left in limbo. We didn't know when services were going to resume. We didn't know, could we get into hospitals for appointments? I mean, to this date, partners still aren't allowed in. It's still a one-parent system, and that takes a massive toll on a family. And I think in terms of families' mental health, yes, we can look at the figures of everything else that's going on, but families in isolation with babies with additional resources, they need help, because we are now starting to come through, and we're starting to realize what a toll this has taken on us individually and as a family unit. And I think, you know, that's definitely an area that needs to be looked at, because we are going to end up going into the winter again, possibly into a further lockdown with babies that need these resources. But parents' mental health is also struggling, and that will significantly affect the family unit. And I think that's probably something that we need to look at. But that's just my views on how we went over the pandemic as a parent.
Thank you, Sinead, and thank you so much for sharing your personal story, because you know that's often hard to do, and we really appreciated it, because I think it most definitely gives us such a rounded impression of how the pandemic has affected everybody. Thank you.
Thank you.
We will move on to Margaret, the other Margaret D.
Hello. I have some slides, Alicia, please, if that's okay. Can you hear me?
I can, Margaret. Sorry, I've got Sinead's slides. Sorry, did you send me yours too, Margaret?
Did Margaret McGrath send them?
Let me just see. Sorry, I think you might have sent them earlier. 1 second. I have a lot of emails today. Sorry, I think you sent them earlier today before I realised that. Are you able to try sharing them on your end just while I look them up? But I'll just, sorry, my apologies.
Disabled participant screen sharing.
Sorry, let me. Do you mind just try one more time and see if that works? Sorry, my apologies.
Can you see that?
Yes, thank you. Sorry about that.
Super. Hi everyone, my name is Margaret D, and I am an occupational therapist in Enable Ireland in Sandymount. I work on 2 teams in Sandymount. I work on the school team, which provides services to children with complex physical disabilities and intellectual disabilities, and the school age team, providing services to children in mainstream schools. I am going to talk today about an initiative that myself and some of my colleagues ran. We delivered an evidence-based handwriting group through video. The team I work on within school age is junior infants to first class. So we're talking kind of 5 to 7 years old.
Sorry, you might have to put it on presenter view, Margaret,
okay.
And then do it that way. So just go down the bottom with the little slideshow bit. That's it.
There we go. Okay. So just, I suppose, to give a little bit of background, a lot of the referrals that we would get through for the school age team are around handwriting. You have children in junior infants, senior infants, learning how to write, learning pre-writing skills. And again, it remains a primary mode of communication for children. So prior to COVID, we had been looking at running some handwriting groups. Again, groups are a fantastic way to see a large number of children, to provide face-to-face therapy services for them. And also as well, it gives a nice bit of peer support to children to know, oh, there's other children, you know, with the same difficulties that I'm having. So prior to COVID, we were working on developing these groups and putting them together. So it was myself and 2 of my colleagues, Emer Broderick and Tracy Seymour, occupational therapists as well. However, when the COVID-19 pandemic arrived, services were shut down, and again, there was difficulty in providing face-to-face therapy intervention. We still had a group of children who needed intervention, and again, we had quite vulnerable service users here. So a lot of cocooning, a lot of vulnerable siblings, vulnerable parents, or vulnerable children themselves. So again, across the board, we've had to be creative in finding methods to deliver services. So what we decided to do was look at the feasibility of running our handwriting groups online if possible. So we had already completed a literature review to inform our session plans. There's quite a lot of recent systematic reviews looking at handwriting programs and handwriting intervention within occupational therapy. So we understood how best to form our groups and the best way of, I suppose, doing some sensory motor activities within the context of handwriting practice. So we then identified some service users for the potential groups, and we sent invites over. We sent invites via the admin team, and we let parents know that we were going to be running 4 sessions, 2 groups, 4 sessions, 1 pre-writing group, 1 handwriting group. It was going to be online, and we did 1 morning group and 1 afternoon group. So parents were sent resources by post, and they were to help service users participate in the group. We also completed outcome measures as well. So just some of the pros and cons of online groups. We sat down and we had quite a discussion about this to see whether or not it was feasible to move them online. So, online groups, we can provide therapy without the need for face-to-face intervention. We're keeping families safe during the pandemic. Service users were familiar with online groups and the technology. A lot of children were using something similar within their school work, and the research would support the group format as well. However, we'd also have to be aware of some of the cons to this. There is a risk of digital poverty. Not all families have access to computers or the Wi-Fi as well, and it was something that's been discussed multiple times within the context of education over the pandemic, that not every child has access to this to be able to provide education. Families would have to provide some of their own resources as well. We also ran our groups during the summer holidays, so the timing as well was, we were wondering whether or not we would get uptake from parents, because they've spent the last 4 months trying to, work with computers, work with technology within the school setting. So we did 2 groups. Our pre-writing group we had 4 children out of 14 who were invited. Parents were provided with paper, markers, crayons, Play-Doh. They provided those, and we sent out paper resources, so anything to do with the practice. We formed the groups by looking at some strengthening activities, some sensory motor activities, and then therapeutic practice. The outcome we used for the pre-writing group was the Beery BMI, the first 2 pages of it. So this is it's a standardized outcome measure that we would use in occupational therapy. The second group would have been a letter formation group, so children who are in senior infants into first class, who are starting to form their letters and having some difficulties with that. So we had again 4 children out of 20 who were invited. Same as before, parents provided paper, markers, crayons, Play-Doh, sent out, I sent out some alphabet guides and line guides, and again, we did strengthening exercises, sensory motor exercises, and handwriting practice. And again, it's difficult with that age group to have a standardized outcome measure of handwriting. So we just used the handwriting sample from before and from after. So in terms of the outcomes of the group, we found that there was lots of pros as well as cons to delivering an online group. The big one is the parents didn't have to come into the clinic, which ensured safety during the pandemic. But we said, in terms of progressing this as a service development forward, parents reported that it would suit them more to maybe not have to come into the clinic for groups, because instead of having to pick your child up from school, get them home, get a snack, and get them back into Enable Ireland and Sandymount for a group, it's quite busy. Whereas, if you knew your group was on at 3 o'clock online, you could. There's a lot less stress with there's a lot less stress for attending the group, and the timings can suit parents more as well. So we could do a morning, we could do an afternoon group as well. We also found that we were a bit more tailored and functional when thinking about our groups. We had to really think about what resources are parents going to have at home to be able to implement a group. And also as well, what was great was the parent empowerment and engagement. Before when I've run groups in Enable Ireland and in other services, you bring the children in, children are all sitting in a group, and parents then get feedback at the end of the group. Whereas this time, you know, parents were sitting there, they were engaging, they were asking questions, and it was quite nice and it was quite collaborative, I found, and there was a good level of parental engagement as well. Also as well, there was additional groups identified from this. So there are a couple of other groups that we're going to be running later on in the year. We're also going to be running them online, which is great. The cons though, the technology, there was initial difficulty with the technology. We use Microsoft Teams, managing things like the mute function. You know, you have 4 children and their parents, very excited, very talkative, lots of noise. Teams would only show the person talking, not all the participants up, so that could be quite difficult. Children's attention as the group progressed as well. Normally when we have children in the clinic, we can do quite nice movement breaks and we can keep attention on the task. But when you're at home, it can be quite different to bring the movement breaks into it as well. Service user buy-in. The children themselves weren't overly enthusiastic about coming to an online group. It was summer holidays, they had been doing this for school, it was just too much like school for some of them. And again, getting some outcome measures back from parents as well. You know, you'd ask parents to take a photo and send it back to you, and you know, it was difficult. There was a bit of follow-up with that, just to try and get them all back on time. So I suppose our big take home from this was that online groups do work, they've worked well, and there's something that we would consider moving forward into more of a blended type of service provision. And we are actually planning on running these groups again in November, and actually we're moving to additional groups. So we've got a group on handwriting legibility as well that we're going to run. So the take home was that despite some initial difficulties with technology, there was quite a lot of parental empowerment. They provided a kind of a safe way of providing face-to-face therapy for children. And that is everything. Thank you very much.
Thank you, Margaret. That was really informative. And we're just going to move on to Sinead Bird now, who is a physiotherapist in the CRC. Thank you.
Sorry, I will just share the screen. I just need to bring up the right presentation.
Thanks, Alicia. Hello, everyone. My name is Sinead Bird, and I'm a physio working in the CRC clinic in Dublin. And thank you for giving me this opportunity to share about how COVID has affected the children with disabilities and their families who attend our clinic. And I'll just speak briefly about the challenges and opportunities that COVID has presented to us. And pre-COVID, our service delivery was by the traditional methods, with mainly face-to-face appointments in the clinic and some home visits. And we also had some MDT sessions. And initially post-COVID, a large number of staff were redeployed to other areas of the health service, and a small core team stayed in the clinic. And while services never stopped, they were severely disrupted. And staff came back to the clinic from redeployment in June, and we are now operating at approximately 25% of our pre-COVID levels. So services are still severely disrupted. And we now have the hybrid approach using telehealth, home visits, and face-to-face. And we also have increased the number of MDT sessions we do. Next slide, please, Alicia. And my experience of how COVID-19 disruption has affected children and families in our service is on a continuum. And on one end of the continuum, some children have thrived as I perceive from a physio point of view, and other children have regressed. And I think most children fall within this continuum. And I have seen children who have not attended for 4 months due to COVID, and they have been the same or better than if they had been attending regularly. Yet I've also seen children who have regressed from where they were pre-COVID. And I think the reasons for the difference is multifactorial. And I think the understanding of physiotherapy families have, the support network at home, and also medical circumstances play a big role in how families cope during COVID. Next slide, please, Alicia. And when talking about the challenges, I think it's important to link in with children and families about what their challenges are. And I thank Sinead for sharing her story. And personally, I have found the reduced frequency of treatments challenging. Pre-COVID, I may have seen a child every week for 6 weeks, and now I have to see them once in the 6 weeks. And as a result, the treatments become more condensed, trying to fit as much as possible into that one treatment session. And added to that, everything takes so long to complete. And another challenge is the telehealth learning curve, which you're all on. Next slide, please, Alicia. And despite all the negatives, I think COVID has provided opportunities to evolve our health service. And as mentioned earlier today, I think it is important to link in with children and their families to have a say in how their health service evolves. And for me personally, COVID has given me an opportunity to stand back and look at the big picture, both in relation to individual children and overall service provision. And it's not often we get this opportunity to pause and to look at things from afar. And COVID has also given me the opportunity to focus, for more focused communication with children and their families. And as a result of talking to families pre-session, I have focused more on treatments that are important to them. I have more home visits, and I think this is beneficial to both the clinicians and the families. And also, we have had more multidisciplinary sessions, which I think benefits all. And another positive of COVID has been the international collaboration, which has started as we all strive to provide the best service possible. Thank you for listening.
Thank you, Sinead. That was a really good overview, and I suppose a lot of services can reflect on and agree with a lot of, particularly the community services, that we've all had similar experiences as yourself, which, so you capture that really nicely. I suppose we now want to just see, ask everybody else we're opening the floor, as it were, for anyone else who's participating today to comment or to contribute your own experiences, or even suggest some of the solutions you might have used, or even in relation to some of the talks you've already heard. And thank you all to all of our speakers so far. I think it has given us a lot of food for thought. Is there anyone who would like to? Lisa. Okay, yes, so use the hand if you wish to speak. So Lisa, do you want to go ahead?
First of all, I wanted to thank you all for a very, very interesting floor time and presentation in different areas. I did want to ask, if I may, Margaret D, about the group sessions, because I'm trying to go through with the COVID-19 was the ability, the ethic issues that we had with the ability to telecommunicate through having group sessions with children and parents, especially regarding different cultures. And I wanted to know if that was something that you addressed? Because I noticed that you said that you had 4 children participating out of 16 or 4 out of 20. And what happened to the other family, if that was any kind of issue that you needed to take into consideration?
I suppose for us, the biggest consideration, I think, for the attendance point of view was the timing of it. We ran them over July, and I think parents were quite jaded with use of technology, with having had the previous 4 months trying to encourage children to attend online school. I think that was our biggest setback to that, and we're going to try and run the groups again at a different time and see whether or not we have we have greater uptake. But actually some of the ethical stuff is quite interesting. How when you have a parent and a child with additional needs, and then you have multiple ones all on screen at the same time discussing possibly sensitive information with them, it was quite difficult to give, I found, to give very specific feedback within the group context. So I was constantly trying to take notes that Anne needed, she needs to work on her pencil grip, or Patrick needs to work on his posture when seating. And you don't want to, you're aware that you don't want to give families too much individual feedback in that, and how best to give feedback. So it is something to consider. Culturally, we actually didn't consider it. There wasn't, we looked through a caseload, and there wasn't really anything we had to consider for this particular group, but it's an interesting one to consider going forward, I think.
Okay, thank you, Lisa. Anybody else? Mairead?
I just, when Sinead was talking, Sinead, I hadn't thought about the impact of just one parent being allowed to attend an appointment. And I can see how stressful that could be. And I suppose it was making me think that we need to be looking at ways of having a virtual piece as part of that meeting, where your husband could maybe have joined in over the phone or some way. Do you think that would have been helpful?
Yeah, absolutely. I mean, when you have a small child that requires heart surgery for anyone is a big undertaking. But when you are the sole parent who can't even get away from the cot for something to eat, who can't understand the full diagnosis, who doesn't fully, you're so busy caring and thinking about how Grace is going to do afterwards, that a lot of the aftercare stuff, and even in terms of her follow-up and all of that, you kind of take half of it away, and you sit there and you're kind of thinking, did he say this or did he say that? And trying to relay it all to my husband then, and again, it's kind of keeping that family unit together, because even though I am her mother, I'm not necessarily the primary parent. We are both primary parents, and we are both equal in her caregiving, but it tends to naturally fall to the mother. But because my husband was temporarily laid off during the COVID, he very much was available for a lot of these appointments and could have participated. So even if someone had said, if you want to video call him and he can listen and take away different bits that I may have missed, absolutely, it would have taken a lot of the pressure off. And again, it's kind of managing your stress with a baby and everything else that's going on. Anything that can alleviate some of that pressure, it would just make a massive difference. And yes, COVID has given us a reason to think things differently. And again, it's making sure that, these new measures are implemented. So even when we go back to 2-parent visits, if my husband or someone else's partner, for whatever reason, can't be there, there is that alternative. And it kind of just makes it feel more inclusive, rather than segregating parents and trying to work it out between them, who does what and who knows what.
Maybe that's something we could think about for another listening and sharing session, to have one around just that topic and get ideas from parents and other clinicians as to other ways we could do that, because I think that's a really important point. Thank you for bringing it up, Sinead.
No, thank you.
We'll just add in that we try and do that in Melbourne now, because we've been in very strict lockdown for quite a while, and we've only been allowed to have one parent, which has just changed recently, which is great. And in our NICU, we were allowed to have, like, both parents could be there, but not at the same time. But for face-to-face visits, if big discussions are happening, then one parent can then obviously join via telehealth as well. And we've had to do that even with which is a different aspect of it, but with our student placements, because we can only have a certain number of people in a room, our students, we might have a face-to-face visit, but a student will join virtually. So we might have a student virtually plus another parent virtually, and then the therapist, the baby, and the mother or the father in the room. And we have, I think particularly with babies, I find too, and working in neonates, a lot of fathers do come along to our sessions and want to be involved.
Just struck me talking about it, Margaret brought it up too, saying that Teams didn't allow you to have more than one person on screen at a time. So maybe that's something we need to look at too, and to get information from other people as to which systems work best, because obviously Zoom works really well when you've more than one person. And is that the best one, or are there issues around? I know in Ireland there definitely were issues around using Zoom. In the beginning, people felt it could be crashed easily and it wasn't as confidential, but maybe that's another thing we need to look at too going forward.
Yeah. I think as well, Margaret touched on the term digital poverty, which perhaps is a new term that has arrived. And I suppose, I know, Alicia, you're saying that that's something that has come up a lot in the other sessions. And I'm not aware of any kind of funding that was available to families for getting devices for home, either to engage in telehealth or schoolwork. I think some second level schools have now got funding, and post-primary have funding for laptops. So, you know, at least that's a starting point, but I'm unsure if anybody knows if families had access to funding for laptops or tablets or things like that for telehealth.
Not in Ireland, I don't think. It was really difficult to get them. I know we've some families who still wouldn't have them, and it was quite difficult. And it, you know, it does exclude from certain therapy solutions, like within a pandemic.
Vicky,
I can't find the raise hand button. It's not there.
Okay.
I was just going to say it's been a real talking point for in terms of assistive technology, and I'm working with the Regional Assistive Technology Service covering CHO2 here. But definitely there has been no provision of funding for families to get technology for that purpose. So it's been a real challenge, but I think an equal challenge, I think somebody else already mentioned that, has been the provision of technology for staff. And one thing you mentioned, Mairead, with the Teams setup there where you can only view one person at a time, that's possible. You can view multiple people if you are using the Teams app, but you have to have a device which can support that. And so I think a lot of times staff were using maybe their own personal device and things like that, where they were using the web browser, which doesn't support those features. So there's a big piece of work around that, a huge need, I think, going forward. But I know locally we got, I think, 3 or 4 old laptops donated from a local company, and that was the extent of provision for service users that they were given to families who weren't in a position to privately fund a device, I suppose, for the purpose of teleconferencing.
Okay. Thanks, Vicky.
Welcome.
One of the I was just jumping in, but one of the common themes that has been a real concern is that those families who have that digital poverty often can't access anything to let people know that they don't have services as well. So at least those families who can advocate for themselves can use technology, but if you can't access technology, then you're just really, really abandoned. So there's a lot of people who potentially we don't even know who are getting left behind.
Mm-hmm. Yeah.
And just to interject as well, I suppose in parts of Ireland, and the whole other debate is you might have the technology itself, but not the broadband. and access to that. And I suppose maybe for our Dublin, people who are in Dublin, not as much of an issue, but more rural services, probably definitely an issue. So, it might just be there, but not accessible either.
We have just 5 minutes left. So I suppose just to wrap up really, the COVID task force, Marie and Lisa, are happy to be guided by you, but I suppose they're going to continue their work in terms of supporting families and clinicians through the work that they've been doing, both on the resources and the listening sessions and the surveys. And I suppose one of the questions we want to ask everybody is just, have you any suggestions going forward as to what you want from a forum such as this, or from the work of the task force? So be it more training, more listening sessions, further sharing of resources. And if you don't want to speak, you could just type something into the group chat. If everybody gave that a go, that would be just give us some more information, just so we can get a better sense of what actions I suppose we want from this, because COVID's not going away. We're always going to have to be adaptable and develop our flexibility in terms of how we're working. And I think certainly I have found this really useful, and I think it's a really good forum to support each other and to share information, because we shouldn't be reinventing the wheel. And I suppose that's part of the reason why I think us forming an Irish Academy of Childhood Disability is really important, because we have a wealth of knowledge in the country, and I think we need to be sharing it and ensuring that at every level we're providing the highest standards of services to children and families. Has anyone any other final comments before we go?
I just shared a link to the PrEP program there, which is kind of like a way of, I suppose, like chatting around barriers and facilitators and kind of teasing out some like parent coaching. And I found that really useful in kind of the early intervention space that I've been working in, around kind of just channeling and structuring some of the dialogue that you're having with families. So that's a good one to maybe look into.
Great, thank you, John. Mairead, have you?
Yeah, I'd just like to encourage everybody that if you have resources you've found useful that you've developed and you're willing to share them, to go onto the IAACD website and click into the resources section, and you can put up links to it, and we can then share it with everybody globally. And I think, as Margaret said, there's no point reinventing the wheel. We've all found different things that have worked, and maybe something you've developed is just slightly different from something somebody else has used, but that's what's made the difference. So I think just encourage you all to link up and let's share what we have.
I just thought I'd share the website link is down here again for those people who aren't familiar with it, and we will aim to put this session up online within the next week or so, depending on how long it takes to do it all. But I would also encourage you, these sessions are fairly easy, I say now that it's done, to organise, and so I do recommend thinking about using things like Zoom to bring each other together, because for me, having sat in a lot of these sessions, it's a very, whilst there's unique things, there's often common things that we can, if we can share our stories, we realise we're not alone. And unfortunately, even Sinead's story of parents being in isolation is unfortunately not unique, but it is something that we need to advocate more to support. And there's many things that we can do better when we work together.
Yeah, absolutely. Okay, so that's, I guess, it for this morning. Thank you all very much for joining us, and I hope you've found it helpful and useful. Thanks again to all of our speakers for sharing your stories, and I think it just has helped give us a broader sense of how we all are and how similar our situations are as well. And thank you to Alicia as well for our tech support and for joining us with all of her experience. We really appreciate that as well.
Pleasure. Sorry, Margaret D, that I failed you, but you did well. Thanks, everybody.